Thank you for joining us for this short presentation on the annual wellness visits, an opportunity to improve patient care. My name is Dr. Jeffrey Epstein, and I'm the Chief Physician Advisor and Hospital Medical Director. I'm a founding member of the American College of Physician Advisors. I've spoken nationally, and my main interest and passion is physician documentation improvement, CDI and coding. A little bit about me. I've practiced primary care for 20 years, general internal medicine. I helped start the Atlantic Health ACO in April 2012, and I've had a deep interest in population health and value-based care. Now, how did we come to be doing annual wellness visits and coupling it with MACRA and MIPS? Well, annual wellness visits are really good for patients, and when we started this project, this company, we were mainly interested in helping doctors do their annual wellness visits, but doctors didn't seem interested in that. They were more concerned with MACRA and MIPS, and we could handle the MACRA and MIPS when we did the annual wellness visits, so we thought we'd put it together, and when we did the annual wellness visits, just give for free the MACRA and MIPS portion to the doctors to help them with their challenges and with their daily struggles to find more time to be with patients. So why outsource your annual wellness visits to Casa? Well, it's because you'll get significant additional practice revenue. MACRA and MIPS will be handled for you. That burden will be taken off your shoulders. You'll be providing better wellness and preventive care for your patients, and you'll have an excellent professional reputation as you achieve better outcomes and as you document your care and report it to the insurance companies and the internet. The additional revenue is significant. It can be $90,000 to $120,000 per year. We think it'll be in that range and might even be more. Now, there's been a study of a big group that has 17,000 Medicare patients, and I just wanted to call your attention to this line right here. Increase in total practice revenue from about $250,000 to $619,000, about $371,000, and then with 4 physicians in every group, it's about $93,000 per physician, and each physician had about 286 patients. What this study did is they drove their annual wellness visit completion rate to 77%. Each doctor achieved $93,000 on average. Their office visits went up 30%. Their ED visits went down 23%, and they decreased hospital admissions. So actual better care, better outcomes for their patients. MACRA and MIPS. This is a big one. Everybody knows, minus or plus 4% all the way to plus or minus 9% in the year 2022. We're collecting data now. It's going to start in 2019 when the bonuses or penalties will be delivered. What is MIPS and MACRA? Well, 50% of it will be quality, 25% of it will be advancing care information, which is the old meaningful use. It has to do with electronic medical records. Clinical practice improvement is going to be 15%, and cost or resource utilization will be 10%. Well, what exactly does this mean? Real quickly, we're not going to spend a whole lot of time, but qualities, there's going to be 6 quality measures that have to be reported for a minimum of 90 days. You're going to have to test that you've completed up to 4 improvement activities for a minimum of 90 days. An example of that can be having weekend hours or having evening hours, better access. 25% is going to be advancing care information, security risk analysis like HIPAA, e-prescribing, providing patient access to patient portals, sending the care summary, accepting summaries of care. This is what your EMR can do, and we can help you with this as well. And then the cost is all based on claims data that's submitted. But again, if you're doing annual wellness visits and you're reducing your emergency room visits by 23%, you're reducing your hospital admissions by 40%, you can bet you're going to look pretty good in terms of utilization of resources. So what's our workflow? Well, the main thing to take home about the workflow is that we won't be impacting your office at all. We'll do most of our visits at home. We'll do as many in your office as you'd like us to, and we'll coordinate so we don't interfere with your workflow. You give us the names of the patients, we contact them, we get our information filled out, we have our nurse practitioner visit the patients, we generate our annual wellness visit report, we get that to the patient and to you, so you can do a follow-up visit and start filling the gaps and discussing wellness care with your patient and start doing all the fun stuff. Here's an example of a wellness questionnaire. It's just name, address, phone number. This form has immunizations, hepatitis B shot, pneumonia vaccine, colonoscopy, screening tests, mammogram, pap smear, prostate exam, PSA. This is a little questionnaire about fall screening. Are you afraid of falling? Have you fallen in the past year? What were the circumstances of that fall? And then the annual wellness visit report is going to be really important. It's going to be a really well-organized report with medications, medical problems, family history, surgeries the patients had, hospitalizations, and then also immunization and cancer screens, a summary, and a 5-year wellness plan. It's going to be a very nice report. Here's an example of the demographics: name, address, phone number, the medication the patient is on, the doses, the medical problems that the patient has when they started, and any comments can be put on the right side. Allergies, bee sting causes anaphylaxis. Here's the patient had the hepatitis B series in 2014, so they're up to date. They had their shingles immunization in 2014, so they're up to date. They are due for a pneumovax. Here's a list of their primary care physicians, their other doctors, their neighbor, daughter, caregiver, name, phone number, so an easy, nice little contact list. Here's the recommendations. You can see the patient needs a colonoscopy, a PSA, and a rectal exam. They need a pneumovax and a hearing test. It's just a list of things that need to get done. And this is it. If you're interested in finding out more about what we do, give us a call. Contact us on our email site. But we're looking forward to partnering with doctors, working with them on their annual wellness visits, taking care of their MACRA-MIPS problem, and doing something good for the whole system, helping the doctor make more money, take better care of their patients, help them get a burdensome regulation off their shoulders. We're interested in doing this to help patients. It's going to save the system money. And of course, we're interested in developing a business where we can be sustainable and durable and continue to do good work for patients, doctors, and the healthcare system. Thank you very much, and thank you for your time.